to start a little series of fat grafting facts. I have seen about 5 consults in the last 2 weeks of patients who had bad fat grafting somewhere, and there's a lot of misconceptions about how it's done and what the results will be. So fat grafting fact number 1, we get the fat by liposuction. And when we do liposuction, we put a dilute numbing solution in the area we're taking the fat, and then we suction out the fat and that numbing solution along with some blood and broken fat cells. So you'll often see a bucket full of stuff. That bucket is not all fat that we will put wherever we're putting the fat. So we will usually process that fat in some way. Some surgeons process it by just draining off a little bit of fluid. Some surgeons have complicated systems that are sold by different companies to wash and treat the fat. There is all different ways of doing that. But when you look at that bucket of what's removed, not all of that is going in, and it's important to know that. So depending on how the fat is processed, anywhere from 10 to 20% is typically usable fat for fat grafting. So if your surgeon leaves the operating room and tells you they liposuction 2 liters out in your fat grafting surgery, that doesn't mean that 2 liters are going to be put back in or were put back in. So like I said, 10 to 20% typically is the yield from what we remove with liposuction. So your surgeon probably only got 200 to 400 cc's of usable fat. So if you see your op report and it says 2 liters out and then just 200 cc's in, that's completely normal. That is what you should expect with this type of surgery. Now, there are unfortunately surgeons who put more of what's liposuctioned in than they probably should, and those patients tend to have a lot more issues. It's not as common, but I saw 2 patients in the last week who went to the same place, and they both have huge areas of fat necrosis. One of them ended up having an infection in that area and has now scars and a dent. The other one has large lumps of dead fat that I'll need to remove surgically. So it's really important if you're going to sign on for fat grafting, you go to someone who's skilled at it and doesn't put too much in.